Hello, my name is Woodley. I'm the CEO of the Walnut Tree Health and Wellbeing, and I'm bringing you this update in relation to the COVID-19 pandemic and the changes in ways in which we are having to work as a result. And so we have reviewed our protocols and deemed it time now to move to a whole new phase. We will be closing our offices to face-to-face appointments. Some of this work has already started. We are moving to online and telephone services only. By Friday, the 20th of March, our offices in Norfolk and Suffolk will be closed to the public, and our staff will resort to home working and holding sessions via phone and online, and that will commence right the way across all of our services by Monday the 23rd. It's already started for some people, and it's a slow rollover. The organisation is relatively large. We can't just do this overnight, so it is going to be a gradual move. But by Monday 23rd, the organisation will only be doing online and phone contact for appointments, and so the offices will remain closed until further notice. If you need more information on COVID-19 and what you should be doing and what you shouldn't be doing, then please visit the NHS England website, and you can find everything you need there. If you're obviously in Wales or Scotland, then follow the relevant NHS website there. This is a very difficult time for the organisation, and we are having to take on a financial burden of making certain adaptations and changes, and these are things that we will have to manage moving forward. And so if you can spare any financial support, or someone would like to make a donation towards our work, then you can donate via our website www.walnuttreehealthandwellbeing.co.uk. Your funds will be greatly received and will go a long way in helping us with the extra burden of PPE for our crews and the costs incurred with various changes in regards to the COVID-19 outbreak. Our emergency out of hours support will continue. However, a lot more of that will now be done online and over the phone, and only in extreme cases will the crew be dispatched and deal with people face to face. Obviously, we are trying as best to follow protocols and limiting social contact and protecting not just our staff but those who use our service from the spread of COVID-19. But we will continue to run our services and offer the very best support that we can possibly deliver under the restrictions which are now imposed upon us as an organisation. So please bear with us at this very difficult time. We will get through it together. We are great believers in keep calm and carry on. There is no need for panic. Just follow the guidelines. If you need more information, follow the NHS websites, and they are full of the latest and relevant information that you need to know. And if you have any concerns, questions or worries about online or phone services, you can talk to your clinician when they contact you, and they will be happy to answer any questions that you might have. So let me just reiterate that we have moved to a new phase in our COVID-19 protocols. We will be closing the offices as of Friday the 20th of March. Some of our services have already started to move over to online and phone, and this will be completed and will be in place for everybody by Monday the 23rd of March, and our offices will remain closed until further notice. Please keep an eye on our Instagram, Facebook and Twitter pages to follow our social media, where we will keep you updated with the latest news that you will need to know. Keep calm, carry on. Now is not a time for panic. It is a time for cool heads and strategic planning. Stay on the right side of the government advice and keep yourself well. If you feel unwell, then isolate yourself. If you feel that you can't manage your symptoms at home, then contact the NHS or call 999 in an emergency, and help is there. But please think sparingly about how you use medical resources at this time. There's going to be a huge strain on not just the NHS, but the third sector as well as we move forward through this pandemic, and we all need to be compassionate and think of others before ourselves, and that way we will get through in the good old British tradition. So plenty of cups of tea, keep yourself well hydrated, keep yourself rested and isolated, and stay away from the pubs, clubs, cinemas and restaurants. Follow the government advice at all times, and we will get through this together. It's not a time for panic. If you are anxious about COVID-19 and everything that's coming up in the news, if it is causing you triggers, then please bring it up with your clinician in your sessions, and they will be happy to work with you and talk through these points with you at this very difficult time. Until then, thank you for your understanding and your cooperation, and we remain committed to providing the very best services we can, even under these difficult circumstances. But rest assured, we will continue to review, and we will continue to provide the best service possible. Until then, take care, look after yourselves. Bye-bye.